Ever wondered what distinguishes schizoaffective disorder from schizophrenia? The mind, it's a fascinating realm, isn't it? It's a place where dreams are born, thoughts are woven, and emotions reside. But just as with any realm, the mind has its own complexities. Today we venture into the vast landscape of mental health, a topic that is as important as it is misunderstood. In this labyrinth of thoughts and emotions, we stumble upon two conditions that seem to be quite similar yet are distinct in many ways: schizoaffective disorder and schizophrenia. These terms might sound complex, they might even seem interchangeable to some, but they represent unique experiences within the spectrum of mental health disorders. So, let's set aside any preconceived notions, let's open our minds and hearts, as we dive into the intricate world of mental health, and unravel the differences between schizoaffective disorder and schizophrenia. Mental health, a vital but often overlooked aspect of our well-being. It's like the invisible thread that weaves together the fabric of our lives, influencing how we think, feel, and behave. Yet, despite its pivotal role, it often takes a back seat in our day-to-day discussions. Now let's imagine a scenario. We've all experienced physical ailments, right? A common cold, a sprained ankle, maybe even a broken bone. And in these situations we readily seek medical help without a second thought. But what happens when the ailment is not physical but mental? Unfortunately, many of us hesitate, and this hesitation is often fueled by stigma and misconceptions. In our society, mental health conditions are frequently misunderstood, leading to damaging stereotypes and unwarranted fear. People with these conditions are often unfairly judged or marginalized, creating an environment of shame that discourages individuals from seeking help. But here's the catch. Mental health conditions are not a choice. They are not a sign of weakness. They are not something to be ashamed of. They are serious health conditions that require understanding, compassion, and appropriate medical attention, just like any physical ailment. Among these conditions, schizoaffective disorder and schizophrenia are two that are often confused and misrepresented. They're not well known, and many people have never even heard of them. This lack of awareness and understanding only fuels the stigma and makes it harder for those affected to seek help. But knowledge is power. By understanding mental health conditions like schizoaffective disorder and schizophrenia, we can challenge these stigmas. We can replace fear with empathy, ignorance with understanding, and judgment with acceptance. So let's dive in. Let's learn about these conditions, not just for our own knowledge, but for the sake of those who are affected. Because everyone deserves to be understood, to be accepted, and to get the help they need without fear of judgment or stigma. Understanding mental health conditions like schizoaffective disorder and schizophrenia can help break down these stigmas and misconceptions. Schizoaffective disorder, a complex condition with unique characteristics. Let's dive into the world of schizoaffective disorder, a mental health condition that blends symptoms of schizophrenia and a mood disorder such as bipolar disorder or depression. The term schizoaffective might sound intimidating, but let's break it down. Schizo refers to psychotic symptoms typically associated with schizophrenia, while affective denotes mood symptoms. So what exactly are these symptoms? Well, an individual with schizoaffective disorder may experience hallucinations, delusions, and disorganized thinking, much like schizophrenia. These are the schizo parts of the disorder. The affective part manifests as periods of depression, mania, or a mix of both, similar to symptoms seen in mood disorders. Now you might be wondering, how does this disorder impact someone's life? Living with schizoaffective disorder can be challenging. The combination of symptoms can cause significant impairment in various aspects of life, from work and relationships to self-care and leisure activities. The person may struggle to maintain consistent employment or stable relationships due to the unpredictable nature of their symptoms. Moreover, the individual might also grapple with distinguishing between what is real and what isn't, a struggle that can be profoundly distressing and isolating. The mood symptoms can further complicate things, leading to periods of intense sadness, elevated mood, or fluctuating energy levels. However, it's crucial to remember that schizoaffective disorder varies greatly from person to person, both in terms of symptoms and their severity. No two individuals will experience it the same way. Some people might have more severe psychotic symptoms, while others might struggle more with mood symptoms. Managing schizoaffective disorder requires a comprehensive treatment approach, often involving medication, psychotherapy, and social support. It's a lifelong journey, but with the right support and treatment, individuals with schizoaffective disorder can lead fulfilling lives. Schizoaffective disorder, a unique mental health condition that affects every aspect of an individual's life. Schizophrenia, a mental health condition that alters one's perception of reality. Schizophrenia is a severe, chronic mental health disorder characterized primarily by symptoms that disrupt a person's thoughts, perceptions, emotions, and behaviors. It's like living in a distorted world where what's real and what's not becomes increasingly blurred. To better understand, let's delve into the typical symptoms. These are often divided into two categories: positive and negative symptoms. Positive symptoms are those that most individuals do not typically experience but are present in people with schizophrenia. They include hallucinations, delusions, and thought disorders. Imagine hearing voices that no one else can, or having a firm belief in something that is clearly untrue. It's a daunting reality for those living with this condition. On the other hand, negative symptoms are those that disrupt normal emotions and behaviors, like reduced feelings of pleasure, difficulty beginning and sustaining activities, and reduced speaking. It's like having the color and vibrancy drained out of life, making everyday tasks seem insurmountable. Now let's talk about how schizophrenia impacts an individual's life. Schizophrenia doesn't just affect the person diagnosed with the condition, it creates ripples that touch every aspect of their life, from their relationships to their ability to work or study. It's a condition that can be isolating, often leading to a feeling of being misunderstood or stigmatized. But it's crucial to remember that schizophrenia is not a life sentence. With the right treatment and support, individuals with schizophrenia can lead fulfilling, productive lives. It may be a chronic condition, but it doesn't define the person. People with schizophrenia can be artists, scientists, parents, friends, and so much more. Schizophrenia, a condition that challenges the individual's perception of reality and affects their daily life. It's a complex disorder that we're still learning about, but the more we understand, the better we can support those living with it. So let's continue the conversation, shatter the stigma, and foster understanding and empathy. While schizoaffective disorder and schizophrenia may seem similar, they are distinctly different. Let's dive into the key differences between these two mental health conditions, focusing on symptoms, diagnosis, and treatment. Firstly, let's talk about symptoms. Schizophrenia primarily affects a person's thoughts and behavior. It can cause delusions, hallucinations, and disorganized speech or behavior. It may also lead to decreased emotional expression and lack of motivation. On the other hand, schizoaffective disorder also includes symptoms of a mood disorder, such as mania in bipolar type or depression in depressive type, in addition to symptoms that are similar to schizophrenia. So while both disorders share common traits, the presence of a mood disorder is a distinguishing factor for schizoaffective disorder. Moving on to diagnosis, both disorders require a comprehensive evaluation, including a complete medical and psychiatric history, physical examination, and often laboratory tests. But the criteria for diagnosis are different. For schizophrenia, the diagnostic criteria focus on symptoms like delusions, hallucinations, and disorganized speech. These symptoms must be present for at least 6 months, with at least 1 month of active symptoms. However, for schizoaffective disorder, the diagnostic criteria require the presence of a mood episode and the symptoms of schizophrenia occurring together at some point. Additionally, the symptoms of schizophrenia must also be present without the mood symptoms for at least 2 weeks. This difference in diagnostic criteria is significant and helps healthcare professionals differentiate between the two disorders. Finally, let's talk about treatment. Both disorders generally require a combination of medication, psychotherapy, and social support. Antipsychotic medications are commonly used in both conditions to manage symptoms like hallucinations and delusions. However, in schizoaffective disorder, mood-stabilizing medications or antidepressants are often added to the treatment plan to address the mood disorder component. Psychotherapy, including cognitive behavioral therapy and family-focused therapy, can be beneficial for both conditions. But the focus of therapy may differ. In schizophrenia, therapy often focuses on reality testing and improving social and occupational functioning. In contrast, therapy for schizoaffective disorder may also address mood symptoms and help individuals manage their mood episodes. In conclusion, while schizoaffective disorder and schizophrenia share some commonalities, they are not the same. They have different symptoms, diagnostic criteria, and treatment approaches. Recognizing these differences is crucial for proper diagnosis and treatment. Understanding these differences can also help reduce stigma and misunderstanding around these conditions, leading to better support and care for those affected. Recognizing these differences is crucial for proper diagnosis and treatment. Misunderstanding these conditions can have serious consequences. Let's take a moment to consider what that truly means. When we misunderstand schizoaffective disorder and schizophrenia, we aren't just dealing with a simple mix-up. We're confronting a situation that can lead to a cascade of negative outcomes. These range from improper treatment to reinforced societal stigma, both of which can profoundly affect those living with these conditions. Let's start with misdiagnosis. Imagine being treated for a condition you don't have while your actual disorder goes unnoticed. It's a bit like trying to put out a fire with gasoline. It not only fails to address the problem, but it can make things exponentially worse. Inadequate or inappropriate treatment can exacerbate symptoms, leading to increased distress and potentially harmful consequences. Now, let's talk about the stigma. Mental health conditions have been shrouded in misunderstanding and prejudice for centuries. When we fail to understand the nuances of schizoaffective disorder and schizophrenia, we inadvertently contribute to this stigma. Misunderstanding breeds fear, and fear leads to isolation. People living with these conditions may face rejection, discrimination, and a lack of empathy from those around them, simply due to misconceptions about their condition. But it's not just about the individual. The ripple effect of misunderstanding extends to families, friends, and society as a whole. Loved ones may feel helpless, unsure of how to provide support. Society may be quick to label and ostracize, missing the opportunity to foster inclusion and understanding. The truth is, mental health disorders are not one-size-fits-all. They are complex and multifaceted, just like the individuals who live with them. By reducing them to stereotypes or misdiagnoses, we do a disservice to those affected and to our collective understanding of mental health. Awareness and understanding are powerful tools in combating mental health stigma and ensuring appropriate care. It's not just about getting the diagnosis right, it's about changing our perceptions, our conversations, and ultimately, our actions towards mental health. Knowledge is power, especially when it comes to understanding mental health conditions. So before we wrap up, let's take a quick stride down memory lane and revisit the vital points we've uncovered today. We embarked on this journey by acknowledging the importance of understanding mental health. We established that mental health is as crucial as physical health, and the stigma surrounding it needs to be dismantled. We underscored the need to treat mental health conditions with the same seriousness and empathy we afford to physical health issues. We then delved into the complex world of schizoaffective disorder, a mental health condition that combines symptoms of schizophrenia and a mood disorder like bipolar disorder or depression. We discovered that individuals with schizoaffective disorder experience periods of mood disturbance and psychosis, which may include hallucinations or delusions. Next, we ventured into the realm of schizophrenia, a severe mental health condition that alters a person's perception of reality. We learned that people with schizophrenia might experience a range of symptoms including hallucinations, delusions, thought disorders, and movement disorders. One of the most significant parts of our discussion was the contrast between schizoaffective disorder and schizophrenia. We noted that while both conditions have overlapping symptoms, the key difference lies in the presence of a mood disorder in schizoaffective disorder. This difference is crucial in diagnosing and treating these conditions appropriately. We also highlighted the detrimental effects of misunderstanding these conditions. Misdiagnosis can lead to inappropriate treatment, further complicating an individual's journey to recovery. Additionally, societal misunderstanding can foster stigma, isolation, and discrimination against those living with these conditions. The journey to understanding is a continuous one, and it's essential to remember that these conditions do not define the individuals living with them. They are just one aspect of their multifaceted identities. Every person is so much more than their diagnosis. In recognizing and understanding the differences between schizoaffective disorder and schizophrenia, we take a crucial step towards fostering empathy and compassion for those living with these conditions. We also pave the way for more accurate diagnoses, more effective treatments, and ultimately, a more inclusive society. So, let's continue this journey together. Let's continue to learn, to understand, and to advocate for mental health awareness. Let's continue to break down barriers and create a world where mental health is not a source of shame, but a catalyst for conversation, understanding, and action. Thank you for joining us on this enlightening journey. Your willingness to learn and understand is a testament to the power of knowledge and the potential for change. So, let's keep the momentum going. Remember to like this video and subscribe to our channel for more enlightening discussions on mental health. Together, we can break down barriers and foster understanding.